So, welcome to Love Heals Cancer and Zenonco.io. I'm Astha from Zenonco.io. This is our cancer healing journey talks where we invite speakers who have gone through cancer, maybe as a patient, caregiver, or survivor. These CHJs are very close to our hearts because many patients tell us that when we listen to other people's journeys, it inspires us, it helps them boost their confidence, and gives them hope that if others have been able to successfully beat the disease, then why can't they? So, thank you so much, sir, for joining us today for our cancer healing journey talks. And could you just introduce yourself and tell us how it all began?
So, Asta, thanks for the opening note. So, see, I'm Vinod. So, completely born in Chandigarh, brought up in Bombay for about 6 to 7 years, then moved to Chennai in 1981. And then on, I've been in the same place at Chennai. So, you can call completely a Chennaiite actually. Uh, I finished all my schooling, college, everywhere, all in Chennai only. And then 1997, I joined American Express. Then on, I've been in the career journey currently with Cognizant Technology Solutions as a business consultant. So yeah, life was all good until 3 years back. There was a kind of a personal setback for me. So throughout my life, I've been very close to my father. I mean, we right from the younger days, I used to be. I mean, he used to treat me as his friend, and we used to have a good time. So I have a younger brother and an elder sister. So out of the all three, for whatever reasons, like he used to. I wouldn't say soft corner. He was actually very hard on me because I'm not too good in studies. But somewhere he felt that when I joined my career world, he realized that I'm more responsible and matured enough to handle things at the family front. So at that time itself, he started passing on the baton to me to take all important decisions of the life, whether it's for my mom, whether it's for my sister, or for him, or for my wife. So that was the notion he had. Of course, all along he was my friend. So 2019 August 12th is what the setback started. So he had some difficulty in breathing. So first we thought or asthma. He had some bronchital issue. But what happened was on scan we took him to the hospital and we found that he had pleural effusion, which means water was overflowing from the lungs. Actually, the lungs was completely surrounded by water and fluid rather, and he had difficulty in breathing. So on diagnosis, the water was 4.5 for any human being looks like there should be hardly about 800 ml to 1 liter of fluid, but 4.5 liters of water was extracted. So, and then the root cause was done when the biopsy was sent. It was found that he had a cancer. The cancer name is mesothelioma. Basically, it starts in the lung portion. So then on, it has been a uphill task for me. This was in August 2019. So October 2019 is what we diagnosed. So the first initially doctor said it's going to be a sitting of just 6 chemos. We were all fine. At that time, we didn't know what to do. So we went on and on and on. Finally, it spanned that it is a terminal disease and it is going to be a lifelong chemo for him every 3 weeks. So that's how it all started. And from then on, I've been holding his hands. He was all good. He was keeping good. He used to be a nice person, and he was a professor in a college, so he was loved by all his students. So that's how he was a very nice, humble person, very most loving person actually by everyone. Everyone loved him. But somewhere where it all spanned out is until 41, 42 chemos, they were all keeping good. Suddenly, don't know what happened. It started spreading to abdomen. I think from then on he lost his willpower. So until 2.5 years, he was sustaining, but somewhere he lost his willpower in around December 2021. He lost his willpower. So slowly he started sinking. So Jan 23rd, 2022, he passed away. Yeah, at one thing which definitely I would say is it's a relief for him from the pain because the cancer doesn't stop with just the that particular day's procedure. Then after you come home, take another 3 supplement pricks, another weekly prick. At home, you have to give injection, food restrictions. Adding to that, he had his mental trauma as well. So I had to handle everything. So that's how it all started. Since you asked how it all started, though, yeah, I felt at a very corner of my mind, I still feel that it is a relief for him because I've seen him for roughly about what 2.5 years, roughly about 1,000 days. I've been with him throughout every minute. I've seen him suffering in pain. It's a relief for him. But at the end of the day, he's my dad, so I'm not able to still accept it that he's not with me. Yeah, it's slowly kind of reconciling. Time is the only healer. So that's how it's all. That's why I'll close the episode, Asta.
Yeah, sir. So, sir, I had a question that did he had any pre-existing comorbidities or any family history in cancer?
Okay, he did not have any comorbidities until he was this was diagnosed in 75, 1944 born, yeah, 2019. So 75 until 75, he did not have any comorbidities. But pre-history, his mom passed away in cancer in 1991. So that's what basically my grandmother. So yeah, that's how. That's it. That is it.
Okay. So, like, what was your and your family's reaction, like, when it was diagnosed?
Oh yeah, I still remember that date. Still remember that day. Non-acceptance from our side, we were not accepting it. Me, my sister, and my brother, we got together. My mom is not. She's not too educated person. She is a very naive person from the village side. So she to make her understand was a bit difficult. But since with the whatever education my dad has given to me, my sister, and my brother, initially there was a non-acceptance. We were all shocked. Actually, the diagnosis was to be in what was to eliminate one by one. So they thought of pneumonia or tuberculosis or cancer. So we were all praying it should be pneumonia or tuberculosis because that is easily handleable. But unfortunately, it came out cancer. So that time itself, we started slowly kind of, oh, okay, this is what it is. It was a shocking news. We had to break it open to him in a very, 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 uh, what's say, very subtle manner. Adding fuel to there, what happened was that the hospital we went, they sent that biopsy to Tata Memorial in Bombay. So what happened was there it came as negative cancer, cancer negative. So we were all very happy. In fact, the day it was day on 5th September, it was the news was broken that it is not a cancer because Tata Memorial, so-called Tata Memorial, which is the epitome of the biopsy results for all over India, right? They themselves have said that it is cancer is negative. So 5th September happened to be my sister's birthday, Teacher's Day. So I still remember she holding his hands and saying, "What more gift you want on my birthday? That is not a cancer." So we were all very happy. So 6th September we went to the hospital. We showed the report. We didn't take him, of course. Me and my brother went. But for some reason, our pulmonologist who was treating the lung infection, he was not ready to accept the fact that it is this. He was not ready to accept this report. Then he said, "We need to do a second opinion." We were not at that time. Again, we were not ready to do that because they had us come. Tata Memorial has said, "What more do you want?" Actually, we were. We went into a fight. We went in an argument mode to the doctor. Then the doctor convinced us, "Sir, no, sir, we want to do it. Please understand. I'm also interested." So then we did a second opinion in Apollo Cancer Center at Chennai. I still remember that pathologist head, Anne Kurian. So that report came positive. So I called her. She was very busy. I said, "No, you have to talk to me." I waited there for about 3 hours and I waited her. She took me to her cabin. She did the test by herself. And she said, "Sorry, sir, this is confirmed cancer. I can definitely tell wherever I need to produce." Yeah, so they gave a positive report, and yeah, so that was another drama over there. So first it came negative, then we have told it's negative, then it came positive. We do not know what to break on, how to break. Then on 27th September, we had to break. Yeah, uh, he being a professor, he understood, but still he could not accept it. Yeah, we were all shocked. That was the initial state of mind.
Yeah. So like, what all treatments did he undergo?
So he underwent only chemo because for his age, surgery was ruled out because already they had already performed a surgery about 2 months back for this lung infection thoracotomy. So they cut open on his back and then they came from the back and clear kind of there were a lot of pores in the lungs. So they stapled it. So there was already a procedure done. And the oncologist said 75, we are not ready to what say uh, cut him open because he will not withstand. Radiation again was not an option for him because again his body condition was not ready to receive a radiation. So we went for chemo only. But the question they asked was, how do you want to take it? We said, see, time is at our disposal. We don't want to go aggressive at all. We will go palliative. Lesser the pain, very less the pain on all the side effects, whatever you can call it. But if it is going to be next 15 years, 20 years, I am ready to take care of him. No problem. It is going to be 1 week or once in 3 days. I am ready to bring him to the hospital. I don't have any problem. But it should be absolutely palliative and absolutely like no pain at all. So that is what the treatment. What is what chemo only, chemo drugs only. So yeah, there are some lot of names of the drugs which I don't want to go too technical. So that's what it is.
Right, sir. So like, when like, as you stated that he took chemotherapy and all, so did he face any other like side effects and
Very good,
comorbidities during the
very good
treatment?
question. Very good question. So when we went for chemo, right? Obviously, like when cancer, you know better, right? So when cancer is stuck to any near and dear ones, the first thing is we start looking at the world. Oh, acha, idhar is ho gaya, wahan aise ho gaya. So what is going to be and all those things. We start looking around the world. Then there will be good people, good with good intentions. They will say, oh, you know what? My mother-in-law had, my sister-in-law had, something like that. They will go on giving that story. So obviously, you get perked up and you get tensed up. So I still remember 27th September, we are taking him. October 29th or 30th October was his mom's ritual, his mom's ritual, the what you call Shrad. So then he requested a doctor, I'll finish my mom's Shrad and then I'll come to take the first chemo. And on October 2nd, Gandhi Jayanti, that was the first chemo he took. So that day, that's the first time I'm looking chemo live. Okay, so what is happening? They're putting something. I was going on looking at his face. Something is going to happen. Something is going to happen. October 2nd, October 3rd, October 4th, October 5th, nothing happened. He was all fine. Then I was a bit whether the drug is working or what is happening because so many stories we have heard. Only one thing he complained was, Vinod, I'm feeling a bit tired. I want to sleep. Dad, Appa, how are you feeling to eat? अभी मुझको एक samosa खाने का है. That was his mindset. Though he was restricted because it's fried and he had 2 liters of water daily restriction. He wanted to have that what do you call that Irani samosa वो north में मिलता है चाय के साथ. So he wanted to have that. Then Appa, I said, how are you feeling? Are you feeling nausea? Are you feeling? Absolutely not. Fantastic. So then the next chemo we went. The second chemo we went to the doctor. Doctor said, absolutely don't worry. This will not have any side effect at all. Nobody believed us actually. Then they said, since you told palliative, we are going very slowly. So that was the thing. So absolutely no side effect except for he was feeling a bit tired for the first 2 days. That's it.
Okay. So it's a good thing that he did not face those much side effects. It's a nice thing. So like, did you consider going for any alternative treatment or any complementary treatment?
Complementary meaning? I didn't get that. Alternative or complementary meaning?
Yeah. So alternative, that means not taking a medical treatment and going for any alternative one. And complementary means with medical.
No, not really. Some people suggested something Ayurvedic in Kerala, you need to go there and all those things. No, we didn't think of that. We didn't think of that. We were happy with the hospital. We were happy with the doctors. We were happy with everyone over there. They took care of us like anything. So dad also felt really at home over there. In fact, I used to, on a lighter note, I used to keep Papa, come, we'll go for another picnic now. That's what we used to uh, converse like that. And he used to love to go to the hospital actually.
That's good. So, like, as a caregiver, like, how did you manage your professional life and your social life?
Okay, so see, basically, since you're talking about the caregiver, right? First, I need to talk about myself. Okay, I'm a very, very, very happy-go-lucky person, very carefree person. I don't, I don't take anything to heart. Life is too wonderful to be spent worrying. That was my, in fact, my WhatsApp is also like live every moment. That's my tagline. You have to live every moment. Even now, you have to live. कल क्या my anthem is that famous in the यहाँ कल क्या हो किसने जाना जिंदगी एक सफर है सुहाना. That's my anthem actually. हंसते गाते कहाँ से गुजर दुनिया की तू परवाह न कर. That's the point. So yes, I was shocked. uh, I have not read any books. I have not read anything. My relatives tell me that my emotional quotient is very high. I do not know what it means, but I have to handle the situation. That's what I could sense. And so, what was the question? So, caregiver. Uh,
Yeah, so like, how did you manage your professional life and your
how did you
social
manage
life?
professional life and social life, right? So, let me come to the professional life. Uh, God has been kind to me. That I've been in cognizant for close to about now, as I speak, I'm finishing 13 years. At the time, I already completed 10 years, and I have the same managers and same set of team members and my peers. So they knew my situation, they extended the support. I openly had a chat with my boss and say, sir, this year I am not expecting any rating. I will ensure that there is no escalation from the customer. I'll do the basics. वो क्या तनख्वाह मिलता है क्या for whatever salary I'm getting, I'll work perfectly. Don't expect that above and beyond. And at the same time, I will not go down and give you some escalations. No, I'll be doing a straight line work. They agreed that, and that's what God has been kind to that in the professional world. On the personal side, in the entire family, they look upon me for whatever reasons. They think my sense of humor is very high. Uh, I definitely did not go into the shell. Oh, this has happened, so this is a setback. No, I ensured that wherever I go, I have a smiling face. And I also ensure that I take my dad along. So nobody should feel should show empathy or sympathy towards him. Everyone should be feeling happy. So social life, I did not shy away, but at the corner of my mind, I was a little bit careful when I speak. But generally, all my relatives accepted me. So yeah, that's about the personal and social life.
Okay, so like as a caregiver, while his treatment was going on, there must be a lot of tension and lot of emotional stress and mental pressure. So like, how did you handle all of that?
Oh yeah, don't ask me. So a lot of mental stress and and what's the emotional stress I had. So unfortunately, adding fuel to the fire, the biggest thing was the corona, and I was at the peak of corona. So August 2019, or rather October 2019 is the first chemo, and March 2020 we are having the lockdown, and from March 2020 till Jan 2020 2022. So it was almost like I was going through the peak of corona, no blood donors. So I have to thank my wife actually. She has been extremely supportive. She is also working, but extremely supportive. She's a very, very silent person. But she, so when there was a blood donation request that needs to be done, so I call from the hospital and tell my wife that Appa needs 2 units of A positive blood. So immediately she will call about 400, 500 people. My sister used to call 400, 500 people. So I have to thank my wife on that. So the stress was always there in the blood, when for the blood request, or for that matter, what's that, platelets was going down. Yeah, I mean, if you ask me, I don't have a structured answer. I just handled it. That's it. I do not know. I didn't do anything extra. Probably it's my nature. But if I look back and retrospect, right, I don't know what I did. I don't have any answer, structured answer. I handled it. That's it.
Okay, sir. So, sir, I had a question. Like, what all things helped you the most in this entire journey? Like, while he was undergoing the treatments and also, what all things helped you the most?
Helped meaning, sorry, I didn't get the question. Helped meaning, what helped
Um,
meaning?
so any people or any type of specific treatment or any doctor, someone who helped you the most during this entire journey.
So people who helped, or say, okay, for what are the first question? Now you started with something. What helped you is the
Yeah,
question.
what helped you the most in your entire journey?
See, what helped me the most is first my family. Okay, my wife, my brother, my sister. We four were there, and they were behind the scenes, and I was in the front. Uh, they used to kind of keep okay, asking questions and suggestions and all those things. So if I, so that was the first thing. Okay, so I felt that okay, I'm not alone. There are people who can help. The next is the hospital. Okay, I have to name the hospital. It's VS Hospitals. You can Google that later in uh, in the web in Google. It's a VS Hospitals based out of a place called Chetpet, CHETPET. The doctors, the nurse, the pantry person, the janitor, the reception, the insurance, the cash, the pharmacist, everyone helped actually. Everyone helped. And over there, everybody started loving dad actually. So they also started they used to call him very lovingly Appa. They come and get blessings. They say, I have a marriage at home. I have a betrothal, so on and so forth. So they helped a lot. They helped a lot. So So at one hand, emotionally, I was supported by my wife, my brother, and my sister. Of course, other extended family members like my uncle, aunt, everyone were supporting me. Some of the people called from US and they asked everything, how are things and all those things. So health is of course the hospitals. Of course, I have to name here the financial aspect. Again, God has been kind to me. So I'm in cognizant. My sister is in cognizant. My wife was at cognizant at that time. My brother was he's in Microsoft. So everyone were covered for insurance. So financially, touch wood, touch wood, touch wood. God has been very, very kind to me. And yeah, normally there's a saying, right? God, when He closes one door, He opens another door, right? Yeah, He gave us a big jolt, but He gave us complete support system everywhere. So this is very, very important in this cancer journey. Uh, that is the reason why I am able to kind of uh, pass on my experiences to many people because one hand it was a big, big, big shocking news, but if you start questioning God, that is wrong actually. He ensured that he gave all the support systems and then gave this big shock. So yeah, it was balanced. It's just that my dad had to suffer and he had to leave. Yeah, that's what it is. So financially, it was helped by our Cognizant and Microsoft on insurance. Uh, from the treatment point of view, hospitals helped, and the most important thing on the stress and the emotional things. Uh, of course, all credit goes to my family members, my wife, my brother, and sister. So that's of course my mom, she being a bit naive and innocent, all she could do is cook and give it us. She's a very actually she's an iron lady, but as a help she used to give home food. So that's the biggest thing I would say.
Yeah. So, as you already know that maintaining a healthy lifestyle is very important, especially during treatment. So, like, what all lifestyle changes did he undergo during the treatment?
See, lifestyle. Let me be again. Let me be very honest here. Okay, so my dad generally is a person who is a very laid back, serene life. He is not a venturing out guy. उनको एक easy chair दे दो, he's happy. He doesn't go out. He doesn't meet friends. He doesn't go for movies. Nothing. All he loves is his profession, teaching profession, and an easy chair. That's it. Even when we call him Appa, come, we will go. Even not in during cancer. I'm saying generally when he was hale and healthy, right? Ah, you people go. I'll take
Yeah.
rest. So what happened was that was a blessing in disguise for him actually, because doctor said you should not go out, you should not get exposed to sun, you should be in the same place. And adding again, COVID was another thing where you need to quarantine, you need to be in one place. So that he was like the best what's a framework for him to be there. So he said, Acha, now I'm a cancer patient. Now let me lie, I'll lay on my easy chair. Now you guys give me food and water, whatever you can. So there was for him, there is no change in lifestyle actually.
So like any I was wanted to know about his like diet or physical
Oh, diet.
activity and all.
Yeah, diet. He had diet restrictions. But again, we are all pure vegetarians. We don't eat non-veg, not even egg. So that was again okay. So doctor said as long as you're taking protein and anything which is boiled and not fried. So basically, the logic is for any cancer patient, the first two, three organs that get affected is your digestive system. So one of the organ which immediately gets affected is the digestive system, which is very sensitive. So which means you should not give stress or more work to digestive system. So that's the reason they said take as much as bland food, so that if you take chili or oil, no, the digestive system tends to work more, and that will create some issues. Yeah, but anyway, we being which was our staple food, like our pulses and boiled rice, ghee, and all those things. Of course, we were not having any fried items or anything. Yeah, once or twice, he might have that urge to have this. Okay, I have a Irani samosa or vegetable puff. Yeah, but dietitian used to say, sir, don't have it. But then she called me and said, just give him 1 hour half or something like that. Yeah. So diet, no major change. Only thing is, they asked him to take what's that, the chana and all those things. The actual, okay, उसको क्या बोलते हैं? Kabuli chana and chickpeas,
Chickpeas and all.
chickpeas and
Yeah,
all those things.
chickpeas.
No, but he was not a guy who first of all there was nobody to make at home. My mom you doesn't make at home, and second thing he also doesn't really uh, he doesn't have the urge to go and take it at so 2 o'clock or 3 o'clock. They asked him to do every 2 hours, 3 hours, break the pattern, but actually he did not follow all those things. He was normal morning, afternoon, evening. He used to have his regular breakfast, lunch, and dinner.
Okay, sir. Right. So I wanted to ask, like, what were your top three learnings from this entire journey, like, as a caregiver?
What was your
What were your top three learnings from this entire journey?
top three learnings? Okay, you're asking me all structured questions. Top three learnings. Okay.
No worries, you can tell only one or two, like the major learnings.
The major learning is what you're asking from a caregiver perspective, is it?
Yeah. Right.
See, from a caregiver perspective, the learning is you have to be extremely strong. One must be extremely strong, and logical thinking should definitely be there. Yes, emotions are there, no doubt about it. As I told you in my introduction, I am close to him for the past, I'm now 48, 47, 48. I've been very close to him for the past, or almost like 30 years. Even if you put my, subtract my toddler to college days, right? 30 years I've been close to him, extremely close. I do have highest emotions to him, towards him. But as a caregiver, when this has struck you, right? Rather, you have struck one person, right? You need to put emotions a bit as a secondary. Primarily, logically, you need to start working on it and ensure that the 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 patient doesn't get affected at all. Okay, you don't need one doesn't need to fake themselves and say I'm now going to motivate you. No, you don't need to do that at all. In That's my learning. Okay, I didn't do that. I didn't do that at all. I didn't do that at all. I didn't show sympathy. It was all normal. You'll be able to do it. Don't worry. We'll be able to do. We'll overcome it. Don't worry. That was the only word I was using. Other than that, so the moment all along you have been seeing one person, suddenly you try to become a preacher and you become, especially in my case, it was my dad. Suddenly you'll say, "What are you? You are my son. What are you trying to do?" Right? That I don't think you would have accepted it. So I more another thing is what I learned is in these, especially these situations or these times, you need to give them importance and take every minute guidance from them. Ask them questions. Can I do it? If that person is an elder, can I do it? Can I do it? So these are some of the learnings I did in this journey. Yeah, first, rational and logical thinking is what should come first. Okay, attachment is always there. I'm not asking to get detached, but keep a bit aside. If that person is not able to do, he has to identify some person in the family who can do that. Because that's what my brother did. So my brother is an extremely learned person, but he couldn't see dad like that. So actually, during that surgery of thoracotomy, he couldn't see dad. He said, Vinod, I'm going back to Bangalore. I'll come back after 10 days. You take care of him. I said, fine. Okay, no problem. I'll take care of him. So if that caregiver is not able to do that, he has to seek some alternate person who can do that. Yeah, the learning is you need to be focused to the problem. That is the learning. It has come. That is a reality. I might sound probably harsh or I might be sound detached. No, absolutely not. I'm thinking this because I'm more attached. That is the logic I'm saying. That is a learning. Yeah,
Yes, sir.
obviously it will make you strong actually. Generally in life, it will make you strong. Ah, chalo, kya hota hai? Dekhte hain. As it is, I was a person like that. Now that this has happened 2.5, 3 years, right? I am okay, fine, chalo. Let's see. Yeah, that's what it is.
Right, sir. I wanted to ask, like, what message would you like to give to cancer caregivers and patients?
So first of all, caregiver, as I said, be strong, face it. Yes, it is your near and dear one, the most loved one. I do agree. Face it. Think logical. Uh, don't be careful when you're talking. Be careful when you're speaking to the patient and to the others. And especially when you're talking to others in front of the patient, you have to be careful. So that is very, very important. Don't fake yourself. Don't show empathy or sympathy. Oh, you have come. So don't make them feel as it is they are feeling that. Don't make them all the more feel that they are patients. No, don't do that. Be normal. Be normal. Deep inside you cry. Deep inside you have your pain. If you want to cry, if you're in pain or agony, separately go and cry. Don't do in front of the patient. Yes, that is what I would say to the caregiver. Keep working towards how to keep the patient in full spirit. Okay. Never ever make the patient think that he's a terminally diseased patient. No, don't do that. He's a normal person. He is just like us. It's just a bit of here and there. There are some 2 or 3 cells extra for him. That's it. That is the thought process you should have. Okay. That is for the caregiver. For the patient, what I would say is, yes, it has come. My personal with my learning in my personal my dad, the thing which did not really occur, which did not happen to him was there was no acceptance from his side that he has be he's got cancer. Till that time he's in the last breath, he did not accept that he has got cancer. So that was an issue. But yeah, that is one thing. uh, try to redirect your thought process on things which you really like. For example, unfortunately my dad, as I said, right, he was a serene laid back life. He did not have any friends. He was not a social animal, so he did not know what to do. So there was no diversion for him. But he was a professor in packaging technology. But if you start talking about packaging, right, he will just sit up, start giving lectures like anything on his passionate subject. So whatever you think you had passion before this, whatever the tragedy happened to you, right? Think about that, divert yourself. Some people might like, say, watching movies. Some people might like, say, drawing, painting. Some people music. Some people listening to music. Okay. uh, Try to divert more. Okay. In fact, my dad loves music, but he keeps on listening to all those. What is that movie again? Rajesh Khanna and Amitabh Bachchan. Anand. Zindagi ka
Um,
safar. Kaisa hai safar. He used to listen to all those useless pathos
okay.
songs. I said, Pa, don't even do that. Try to be very, listen to some humor and all those things. For whatever reasons he was doing that, but don't, patients should not go deep inside. Okay. That is my, see, again, Asta, let me be very blunt here. Let me be very blunt. This question actually I should not have answered. No way we can advise to the patients because they are undergoing that. It is their pain, their agony. No person in the world can advise. I'm telling you, it is up to them. It is very easy to say from outside. Very easy to say from outside. You should be like this. You should be like this.
Yeah,
Unfortunately, they
very
are the
true.
people who are facing the brunt. We are nobody in the, not even your own kith and kin, your own wife or your spouse or son or grandson cannot do that. That may be very, very blunt here. We are no person to advise them. We will let them go. Yes, let them. That is one lesson for caregiver. Let them go. Let them react. Let them do whatever they want. You don't react for anything. Let them behave whatever they want. You should not react at any given point of time. That mistake I made at the last minute. I think that is still I have that guilt feel. For some reason he was not eating. Pa, why don't you eat, pa? I just raised my voice. He felt guilty that I'm he he's a burden for me. So I should not have shouted. Still, the last 3 days before he passed away, he did not have he did not have nutrition in his body. So I shouted at him. I should not have lost my cool. Yeah, sometimes you are also a human being, right? As a caregiver, that's why I said no. You have to be very careful when you're speaking. See, caregiver, I can give advice, but patients, I should not give advice. I can give suggestions.
Right, right,
Divert yourself to whatever you like. That's it. That's the only thing I could say which I missed in my dad.
right. That is very true, and I completely agree. Like we don't know what they're
Neither
going
of them.
through. They
Yeah,
everybody is different, right? Every person is
absolutely.
different.
Very
Every
true.
patient
Very
is
true. Very
yeah.
true. Very true. That is a very, very golden words. Everybody is different. In fact, I used to tell the same thing to my dad. Yes, Venkataraman, 1944, 10th July born. Another Venkataraman somewhere in the planet, 10th July 1944 born with some other cancer will have some other treatment. No two people are alike. I cannot say the same thing to another cancer patient. Oh, acha, acha, you be like this. No, you cannot do that. We can give to the caregivers, but
Yeah, very true. So I have one last small question from you. Like if you have to sum up your entire journey in a single sentence, then what would it be?
sum up in a single sentence, what would it be? Generally, is a general statement you want, or
Yeah, anything. Anything. General statement or a quote or any dialogue, anything.
my only thing is this disease should be somewhere eradicated. That's my closing note. I do not know why uh, the moment you say a person says cancer, right? They're happy with AIDS. If you say AIDS, they're happy with anything else, but not cancer. Cancer has become it is a phobia for everyone. Somewhere I feel the medical world should, with so much of advancements, even if when somebody says cancer, it is just like another crocin or 103 or 100 degree. It should that's how it should go. That advancement is not happening. There are a lot of reasons to it, but I don't want to get into that. But closing note, this disease should not be there in the world at all. And even if it is there, it should be the mindset should be like it is just like another fever. That's how it should be. For somewhere there is a lot of what's a big halo or cloud that has been formed that oh it is cancer, so much of things are happening. And yeah, I see same. That is the reason why we are having some good initiatives like Zen Onco, and a lot of such trusts are there, right? Because that disease has been made like that. Why aren't we having this Zen Onco or for Zen fever? Why aren't we having that? Why aren't we having all those like Zen tuberculosis, right? My closing notice: this disease should be treatable. Should be sorry, I stand corrected. Not treatable. It should be curable. Any form of
Yeah,
cancer. Somewhere we that medical world has to transform itself. But other
right.
than that, I don't want to give any dialogues or anything like that because Yeah, I can give for caregivers or patients. Again, I don't want to do all those things. At a very high level, this disease should not, because it is a trauma for both patients and the people around the patient.
Right,
Nobody should undergo that.
right. So, thank you so much, sir, for being in our CHJ session today. And I hope that it will help a lot of caregivers and patients out there. And it was really very inspirational. So, the way you explained everything, it was very nice. And thank you so much, sir, once again.
Thanks, Asta. Thank you so much. So again, thanks to Dimple and Kishanji for this, and I'm willing to help whatever way I can. Okay, if all other things remaining good, I will definitely be able to extend my support. The only thing is, like as I said, I'm in Chennai. Again, language might be a barrier. The way I can express in English or Tamil, I'm not sure I'll be doing justice in Hindi. So that is only request from my side. But yeah, caregivers I can definitely help. But whatever help other than that, whatever help you want in terms of any support or writing article or making PPTs or going on meeting somebody or on virtual, if anything, I'm always there. Just WhatsApp, I'll respond back. Okay.
Sure, sir.
Yeah, and I'm
Thank
wishing
you
the
so
very
much.
best to Kishanji, Dimple, and you as well, to the entire Zen Onco team. Okay. We'll try to
Yeah,
meet up when we are in Bangalore.
definitely, sir.